Today I'm going to answer a question to Dr. Rami. Forgive me if that's not how you pronounce your name, Dr. Rami. You posted a video bonding tie bases into a monolithic zirconia arch or into a zirconia arch, and you showed how it's important to do that on a verified cast. I'm assuming that was a verified cast that you had. So my comment to you was that you make a nice video. Thanks for sharing. Participating is great, and I appreciate it. I see you're got some other devices out there and you're looking to do some teaching, and that's wonderful. You say I said a titanium substructure would be perfect for this case, and you responded that there's a suitable method and potential challenge for every strategy we adopt. Do you encounter any difficulties in placing or cementing a zirconia superstructure on a titanium substructure? I do not. Now, have I in the past? Yes. And have I worked through those issues? Yes. And do I have any of those issues now? I do not. So, you need to make sure that the substructure is designed correctly. You've got your sprues in an ideal location, and that your zirconia fits passively. You got your cement gap correct and all of that. So, if done correctly, with correct protocols, we do not have any problems. We bond it similar to what you were doing to bond those tie bases in, except for it's just like one giant tie base. I saw you were having a discussion with some other doctors in another group around the same post, and they were talking about monolithic zirconia. I am not a proponent of monolithic zirconia. I know a lot of people do it. My issue with that is that I want to have a very strong interface, and I've witnessed zirconia not shrinking 100% accurately during the sintering process. I've actually had other doctors send me sintered zirconia from an STL that I tried on a verified model along with printed arches. And what I found the most consistent fit is with a 1-to-1 mill, and that's a 1-to-1 milled PMMA or a 1-to-1 mill titanium. So it is, I have not experienced anything that fits like a 1-to-1 mill of titanium. When I run my MUA prosthetic screws down with the titanium, it's always spin, 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 dead stop. It's perfect. And that's for me. I use photogrammetry. I strongly recommend using photogrammetry for full arch. I know a lot of guys have different methods of making it work with an intraoral scanner. That's fine. But I want what always works, never breaks, and is as perfect as possible, because I want as few complications in my office. There is zero chance that an arch with a titanium substructure is going to split in half on you or have a catastrophic failure. A chunk may break off. That's fine. I've never seen it happen, but it's possible. But it will never have a catastrophic failure. You're never going to have a loose tie base just hanging out for years or months, causing screw loosening, bacteria gathering, inflammation, infection, bone loss. And it is it is critical, as I hear more and more of complications. I mean, I've done a fair number of retreat cases in my office of people who come to me with problems that they've had from arches that were done in other offices. It is, and I'm not saying that I'm not saying you're doing anything wrong here, but in general, if someone's watching this video, if you're a dentist, it is imperative that you focus on quality in all of your work, but particularly in large implant cases, full arch cases. Things need to be as consistently perfect as possible. Your implant placement needs to be quality. Tissue management needs to be quality. Your intaglio design, your occlusion, everything needs to be ideal as possible. And your prosthetics need to be cleansable, and your patients need follow-up and feedback, because all these arches and patients out there who are having complications and failures and infections, it's gonna end up making everything harder for everybody. So I encourage everyone, stay dedicated to quality and take care of your patients, do what's right, and I wish you the best. All right, take care.